Hello students. Today we will be talking about the spontaneous abortion which is included in the syllabus of genetics. So basically coming to abortion, uh, we will see that abortion is also known as miscarriage, and it is the ending of pregnancy by removing a fetus or embryo before it can survive outside the uterus if the fetus or the weight of the fetus is less than 500 gram at 20 weeks of gestation. The expelled embryo or fetus is called abortion. So basically, when we used to say the term abortion, that means it is the ending of the pregnancy, but there are two conditions. The lady should not cross the gestational age of 20 weeks, that means 5 months. It should be within 20 weeks, and the weight of the fetus should be less than 500 gram. So that is about abortion, and it may be induced or spontaneous. There are two type of abortion. One is induced, which induced means we can induce it for terminating the pregnancy, and one is spontaneous. So coming to the incidence of abortion in India, about 6 million abortion takes place. 2 million abortions are spontaneous, and out of that 4 million are induced. 38,000 death from unsafe abortion unusually worldwide. So that is the incidence of abortion. Now coming to the causes of abortion, it is divided into maternal causes and fetal causes. When coming to the maternal causes, there are maternal infection like TORCH, toxoplasmosis, rubella, herpes simplex virus infection, or any other infections of the mother during the pregnancy. Maternal diseases like gestational diabetes mellitus, pregnancy-induced hypertension, thyroid disorder, or iron deficiency anemia. All these are known as maternal diseases which can cause abortion of the fetus. Some sort of drugs, and if there is any hormonal disturbance, then this can lead to abortion of the fetus. And coming to the fetal causes, there can be chromosomal anomalies. So this comes under the genetic causes. If there is any chromosomal anomalies, bilated ovum, hydatidiform moles, and congenital defect of the fetus. Hydatidiform mole is a condition where the lady will have the lady will feel pregnant, and during the test of the human chorionic gonadotrophin, the lady will be tested positive, but then in spite of the fetus, there will be a tumor-like formation in the uterus. So that is known as hydatidiform mole. So other than maternal and fetal causes, the other causes of abortion are uterine developmental anomalies. If the uterus is bicornuate or it is inverted or retroverted, that is the uterine abnormality. Retroversion of the uterus, fibromyoma of the uterus, surgery during pregnancy of the uterus, and environmental factors like intake of cigarette and alcohol, and immune factors like Rh negative blood group. All these are causes of abortion. So basically it is divided into spontaneous and induced. So mainly we will be talking about the spontaneous abortion. Spontaneous abortion is again subdivided into isolated abortion and recurrent abortion, and it is again subdivided into threatened abortion, inevitable abortion, complete abortion, and incomplete abortion. Now coming to the threatened abortion, this is one type of spontaneous abortion. What happens is, it is a clinical entity where choriodecidual hemorrhage has begun. Choriodecidual means there are two layers in the amniotic sac. One is chorium and one is decidua. Decidua is the endometrium of the uterus, which is known in pregnancy. In pregnancy, the endometrium of the uterus, it turns into decidua, and the placental surface of the amniotic sac is known as chorion. So when the bleeding occurs in this choriodecidual place, that is the threatened abortion. But it may not progress to the stage of irreversibility. This means the cervix is not open and the product of conception are not expelled. So in this condition, baby survival is possible. So thing is that the hemorrhage or the bleeding occurs in the choriodecidual surface of the uterus, but it it can be reversible, and the cervix of the uterus, it doesn't get open, and the product of conceptus or the fetus does not expelled from the vagina. So clinical manifestations of threatened abortion are painless vaginal bleeding without uterine contraction, and cervix is soft. So in diagnostic evaluation, we can do blood test, urine test, ultrasonography, and thyroid test. And treatment is human reproductive hormones, human chorionic gonadotrophic injection, and analgesics can be given. So this is a diagram of a threatened spontaneous abortion. So here you can see that the bleeding occurs in the choriodecidual surface of the uterus. Coming to inevitable abortion, in this type of abortion, the process has begun and progressed to such an extent that expulsion of the product of conception seems inevitable and continuation of pregnancy is impossible. So in this type of abortion, the fetus or the conceptus, the conceptus, it expels to such extent that the pregnancy cannot be continued. So the clinical manifestations of inevitable abortion are vaginal bleeding with clot or product of conception. So here we can see the difference that in threatened abortion, the cervix is closed, so the product of conception, it doesn't expelled out. But in inevitable abortion, it is irreversible. The bleeding occurs and the product of conception or the fetus, it expelled from the vagina. So the clinical manifestations include vaginal bleeding with clot or the product of conception. Diagnostic evaluation, we can do vaginal examination, blood test, or ultrasonography. And treatment is if the lady is pregnant for less than 12 weeks, then we can do suction and evacuation of the uterus. And if the pregnancy is more than 12 weeks, we have to give oxytocin 10 units in 500 ml of NS, and then we have to remove the product of conception. So this is the inevitable miscarriage, where there will be bleeding along with the clot and the fetus. In incomplete abortion, in spite of uterine contractions and cervical dilatation, only the fetus and some membranes are expelled. The placenta remains partly attached and bleeding continues, and this abortion must be completed by surgical method. So in incomplete abortion, when the abortion took place, the fetus and the membranes like chorion and amnion, it gets expelled through the vagina, but the placenta, it doesn't get expelled. So the placenta should be removed by surgical methods. In complete abortion, the products of conception are completely expelled, so it is known as complete abortion. So there is one act known as Medical Termination of Pregnancy Act, which was launched in 1971. So according to this act, this is known as Medical Termination of Pregnancy Act. It is also known as induced abortion, and it is the medical way of getting rid of unwanted pregnancy. So the termination of the pregnancy by the removal or expulsion of an embryo or fetus from the uterus, and the methods are different in different trimesters. In the first trimester, that is from the 1st to 3rd month, the medical methods are, all these are prostaglandin group of drugs, as you have studied in pharmacology. The combination of mifepristone plus misoprostol is given, methotrexate plus misoprostol, and amoxicillin plus misoprostol. So these are the combination of drugs which can be given to induced pregnancy in the first trimester. And surgical methods can be vacuum aspiration, suction and evacuation, dilatation, and curettage. In the second trimester, medical methods are, second trimester means from 4th month to completion of 6 months of pregnancy. The medical methods are misoprostol and carboprost, and surgical methods are dilatation and curettage and hysterectomy, that means complete removal of the uterus. So the complications of the spontaneous abortion are injury to the cervix, uterine perforation, hemorrhage and shock, menstrual disturbance, and chronic pelvic inflammation. Thank you so much.